This combination medication is used to relieve pain from rheumatoid arthritis and osteoarthritis while decreasing the risk of developing an ulcer from ibuprofen use. It contains ibuprofen and famotidine. Ibuprofen is a non-steroidal anti-inflammatory drug, Nsaid, that works by blocking your body's production of certain natural substances that cause inflammation. This helps to decrease swelling and pain. Famotidine is an H2 blocker that works by reducing the amount of acid in your stomach. This helps prevent ulcers. It's important to consult your doctor about non-drug treatments and/or using other medications to treat your pain. It is recommended to take this medication as directed by your doctor and to avoid taking it on an empty stomach. Before taking ibuprofen/famotidine, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually 3 times a day with a full glass of water. Do not lie down for at least 10 minutes after taking this drug. If you experience stomach upset, take it with food, milk, or an antacid. Swallow the tablet whole and do not chew, crush, or split it. Splitting the medication may not provide enough famotidine to protect against ulcers. The dosage is based on your medical condition and response to treatment. Take this medication at the lowest effective dose for the shortest possible time to reduce the risk of stomach bleeding and other side effects. Do not increase your dose or take this drug more often than prescribed. It may take up to 2 weeks of taking this drug regularly to get the full benefit. Take this medication at the same times each day to get the most benefit from it. If your condition lasts or gets worse, make sure to tell your doctor. It's important to be aware of the possible side effects of ibuprofen 800 mg famotidine 26.6 mg tablet. Some common side effects may include upset stomach, nausea, vomiting, headache, diarrhea, constipation, dizziness, or drowsiness. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects. However, it's important to monitor your blood pressure regularly, as this medication may cause a rise in blood pressure. In the event of any serious side effects, such as easy bruising/bleeding, changes in hearing or vision, signs of kidney problems, or symptoms of liver damage, it's crucial to seek medical attention immediately. Additionally, if you experience very serious side effects such as irregular heartbeat, severe dizziness, fainting, or signs of a serious allergic reaction, it's important to get medical help right away. It's important to note that this is not a complete list of possible side effects, and if you experience any other effects not listed here, it's important to contact your doctor or pharmacist for advice. If you are in the US, you can report any side effects to the FDA, and in Canada, you can report them to Health Canada. Non-steroidal anti-inflammatory drugs, like ibuprofen, can increase the risk of a heart attack or stroke, especially if taken for a long time. This risk is higher for older adults or those with heart disease, high blood pressure, diabetes, or a family history of heart disease. Avoid taking this medication before or after heart bypass surgery. There is a rare risk of serious bleeding from the stomach or intestines, especially for older adults. Seek medical help immediately if you experience severe abdominal pain, black/tarry stools, or vomit that looks like coffee grounds, as these could be signs of serious side effects. Other rare but serious side effects to watch for include chest/jaw/left arm pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, trouble speaking, or sudden vision changes. It's important to discuss the benefits and risks of taking this medication with your doctor or pharmacist before use. Before taking ibuprofen/famotidine, make sure to inform your doctor about any allergies you may have to this medication or other similar medications. It's important to also discuss your medical history, especially if you have asthma, blood disorders, heart disease, high blood pressure, liver disease, or kidney problems. If you experience dizziness, drowsiness, or blurred vision while taking this medication, avoid driving or operating machinery. Additionally, be cautious of the sun and limit your alcohol and tobacco intake while using this medication. If you're an older adult, you may be at greater risk for certain side effects, so it's important to discuss this with your doctor. Women of childbearing age should also talk to their doctor about the potential risks and benefits of using this medication, especially during pregnancy or while breastfeeding. Drug interactions can affect how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. This medication may interact with other drugs, increasing the risk of bleeding. It's important to check all prescription and non-prescription medicine labels carefully. Many medications contain pain relievers/fever reducers that are similar to ibuprofen and may increase the risk of side effects if taken together. If your doctor has directed you to take low-dose aspirin, you should continue taking it unless your doctor instructs you otherwise. Daily use of ibuprofen may decrease aspirin's ability to prevent heart attack/stroke. It's important to talk to your doctor about using a different medication to treat pain/fever if you are taking low-dose aspirin. If you must take ibuprofen, talk to your doctor about taking immediate-release aspirin while taking ibuprofen. Take ibuprofen at least 8 hours before or at least 2 hours after your aspirin dose. Famotidine, which is part of this medication, decreases stomach acid, so it may change how well some products work. It's important to be aware of this if you are taking other medications that need stomach acid to be absorbed properly. Always talk to your doctor or pharmacist if you have any concerns about drug interactions with this medication. If you or someone you know has taken too much of this medication and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe stomach pain, difficulty breathing, and extreme drowsiness. It's important not to share this medication with others. While taking this medication, you may need to undergo lab and/or medical tests, such as blood pressure, complete blood counts, and liver/kidney function. Make sure to keep all your medical and lab appointments and consult your doctor for more details. In addition to taking this medication, your doctor may also recommend non-drug treatments for arthritis, such as weight loss if needed, and strengthening and conditioning exercises. These treatments may help improve your flexibility, range of motion, and joint function. Be sure to consult your doctor for specific instructions. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take your next dose at the usual time. Do not take double the dose to make up for the missed one. It's important to store this medication at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When it's expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. It's also crucial not to flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.